Grade 9 students, we are now in our second quarter. Welcome to our learning module in Health 9 Lesson 1. Before we start, I would like you to look at the pictures flash on screen. What can you say about the pictures that you see on screen? Are you aware of this kind of scenarios? The picture that you've seen is related to our topic, which is the science of drug use in the Philippine scenario. We will focus our learning objectives with the following. Number 1, describe drug scenario in the Philippines. Number 2, discuss risk and protective factors in substance use and abuse. Are you ready? Let's start learning! In the Philippines, drug use and abuse is a social and health concern. Poverty has become an increasing cause for involvement in illegal drug trade. According to the International Narcotics Control Board, or INCB, an international drug monitoring agency, the Philippines is listed as one of the countries in the Southeast Asia where drug trafficking is growing in numbers. The Dangerous Drug Board, or DDB, a government agency mandated to formulate policies on illegal drugs in the Philippines, said that there are 1.8 million current drug users in the Philippines, and 4.8 million Filipinos report having used illegal drugs at least once in their lives. According to the 2012 statistics available in the Dangerous Drug Board website, the most common type of substance abuse among Filipinos are shabu, cannabis or what we call marijuana, and inhalants like contact cement and morphine. President Rodrigo R. Duterte assumed office on June 30, 2016, and his government launched an extraordinary campaign against illegal drugs. He declared a war on drugs, targeting users, peddlers, producers, and suppliers, and called for the Philippine criminal justice system to put an end to the drug menace. The war on drugs by the Duterte government has utilized disciplinary measures and has mobilized the Philippine National Police and local government units nationwide. With orders from the President, law enforcement agents have engaged in extensive door-to-door operations. Proceeding with our lesson, let us know the risk and protective factors for drug use, misuse, and abuse. The use, misuse, and abuse of drugs are the result of various factors surrounding a person. These factors either increase or decrease the possibility of a person to use drugs. Risk factors means those influences which increase the chances of using, misusing, and abusing drugs. While the protective factors are those influences which decrease the chances of using, misusing, and abusing drugs in different domains of life. As you can see on screen, a table is being shown wherein the risk factors, protective factors are stated with its corresponding domains, which includes the personal, family, community, the school, and peers. Under the personal domain, the risk factor is the early aggressive behavior, and its protective factor is self-control. For family domain, parenting, and lack of parent-child attachment and nurturing. While its protective factors are strong and positive family bond and involvement of parents in the lives of their children. Under the community domain, risk factor is perceptions of approval of drug-using behaviors in family, work, school, peer, and community environments. Its protective factor is adoption of conventional norms about drug use. For school domain, the risk factors are inappropriately shy or aggressive behavior in the classroom, failure in school performance, and poor social coping skills. But don't worry, the protective factors are success in school performance and strong bonds with institutions such as school and religious organizations. Lastly, for the peers domain, the risk factor is affiliation with peers and showing deviant behaviors. And its protective factors are association with peers and friends who do not use gateway drugs, and reliance on friends for emotional support. And that ends our lesson about the science of drug use in the Philippines scenario. Let us remember that currently the Philippines is on war on drugs, a drug policy of the Philippine government under President Rodrigo Duterte, which aim of neutralization of illegal drug personalities nationwide. And there are 5 risks and protective factors that can influence a person in using drugs, namely personal, family, school, peers, and community. Today, you have learned and perhaps heard the Philippine scenario of drug use and risk and protective factors of drug use, misuse, and abuse. You may have heard and watched in the Filipino movies or from the news on the radio and television or social media. Hopefully, the next time you hear and watch about it, you already have the background and knowledge and you will understand such issues. Congratulations for watching and for being attentive throughout the session. You did a great job. I hope you enjoy answering the module and continue this enthusiasm with the following lessons that we have. This has been your teacher broadcaster, MAPEH Gutierrez, saying, no to drugs, yes to life. Thank you, my dear grade 9 students. Stay safe and God bless.